Hi, this is Lindsay Galing answering some questions for pharmacology. The first question I want to answer is the critical thinking question. The situation is the Emergency Medical Services, or the EMS team, has brought a 54-year-old female patient to the emergency department where you are working. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 from her phone after the woman screamed at her and then fell, obtaining serious scrapes to her arm and her face. The woman is bleeding, disoriented, combative, accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothes are dirty and smell of body odor and urine. The first question is, based on your first impressions of the patient's actions and appearance, what do you suspect she is suffering from? If I were to see this patient, I would think that she is suffering from schizophrenia. Schizophrenia is a disease where the patient can experience delusions, hallucinations, have trouble concentrating and thinking, and have a lack of motivation to get back to reality, just because they don't know what's actually going on around them. So their hallucinations and delusions can seem very real to them. A few things that lead me to believe that she's struggling from schizophrenia is starting with she had no motivation after falling and obtaining the scrapes to her face and her arm, and she was hurt pretty badly. She had no, she was still screaming at the jogger. So if she was actually really hurt and in a right state of mind, she would have gotten help. Another thing that leads me to believe that it's schizophrenia, she's delusional. Normally, an EMS team is there to help the patient or the person in critical need, and they wouldn't really have time to steal a patient's purse. And the person, she's also not thinking straight, which can explain why she has overwhelming fear of all the people standing around her. The medical team is asking her questions, and she's not able to answer them. And confusion, she could also think that, she's not who she really is, and she may actually need a bottle then. The dirty clothing and body odor is just from the lack of being able to prioritize for her and being able to have the willingness to have personal hygiene and make yourself more physically able to be in society. The next question is, what are short and long-term health risks you could suspect from the patients? In my opinion, they're all long-term health risks. The patient has schizophrenia, and if it doesn't get helped, it can get out of hand. And schizophrenia is a long-term disease, a lifelong disease. And so some of those risks are anxiety, overwhelming fear, addictive behavior, substance and addiction, suicidal thoughts or attempts, depression, paranoia, and there's many others to deal with schizophrenia. The next question is, why do you think the patient's hands are shaking? What do you think causes her confusion and combativeness? So I think it's just the overwhelming fear and anxiety she has. She's in an unusual place, and she has all of this medical staff standing around her, and also mixed with maybe a substance she took, or mixed with the schizophrenia, it can make things worse. It can make her be in more of a state of mind where she doesn't know what's going on. Next question is, what assessments do you think are needed for this patient? We don't know the patient's background, and so I think it's really important to get a psychiatrist in there to be able to help the patient and maybe diagnose what they're dealing with. I also think an MRI could be really beneficial for this patient, because it can tell you their brain waves and their function, and it can be linked to schizophrenia then. and to be able to diagnose it so we can help the patient and treat what's going on. And the last question is the research question. Mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this managed and the support of insurance. Is it sufficient, and what could make it better? So I think this has gotten a lot better, and especially with exposure and people talking about it. There's a bill passed that the Mental Health Parity and Addiction Act, and it helps patients get care that they deserve for their mental illness. Insurance companies, it makes insurance companies cover part of the therapies and medication that they need for their mental health problems that they're experiencing. And so it can still be very expensive for them to see these doctors and these medications, and so I think that there still needs to be some work done in that area. We still need to make it affordable for patients to be able to get help with their mental illness. It needs to be more accessible and less expensive, and we are getting there, but for everybody to be able to get help with their mental illness if they're experiencing it, it's important for those things to be more accessible.